Simulation is becoming an important part of clinical training at Florida Hospital. In the last few years, the hospital has invested in and grown a number of new simulation-based capabilities for training and for research. The hospital's Nicholson Center has been training medical professionals for 13 years using didactic and lecture, laboratory, and simulation spaces. This training allows surgeons, fellows, residents, nurses, physician's assistants, and technicians to learn unique skills in simulated real-world environments. The center began with inanimate human mannequins and synthetic tissue models, and from there we added laparoscopic and robotic virtual reality simulators. The Nicholson Center is an education center for clinicians. Doctors, physician's assistants, nurses, they all come here to improve their knowledge by taking state-of-the-art courses in new equipment, new procedures, learning from their peers what the best practices are. It wasn't until 2011 that we received our first research grant through the offices of Congressman Alan Grayson to look at ways to improve education globally. One significant part of that work was focused on creating a national standard curriculum for robotic surgeons. This curriculum included a physical simulator of essential robotic surgery skills and virtual reality models of this device, which appear inside of 2 commercially available simulators. The innovative scientists and clinicians at the Nicholson Center are working with robotic companies to design new simulators. These devices will assist with the education of new clinicians who are seeking to master robotic devices. Our expertise in this area is helping medical device companies improve the instruction that they provide to clinicians. Researchers at the Nicholson Center are working with ARA Virtual Heroes to create an online virtual world. This simulates the surgical operating room and allows the surgeon to learn and rehearse proper team leadership dynamics while following the National Team Steps curriculum. The online environment enables a surgeon to interact with intelligent avatars and to perform their training from any PC on the internet. This online simulation is available for clinicians anywhere, including inside the hospital or external anywhere around the world. Florida Hospital has launched a strategic initiative to improve the way we train our own clinicians. We're creating simulation centers at many of the campuses around the metropolitan area so that our own people can take simulation-based classes at home in their own facility. That's going to make training for these people much more accessible. The first of these simulation centers has already launched. It's open and operating at Florida Hospital's East Orlando campus. There, it's creating jobs for simulation-based educators, and is creating training for all of the staff that reside at that campus in East Orlando, as well as other campus staff that travel there for the new courses that we're offering. Adventist University of Health Sciences is a degree-granting institution where students get undergraduate and graduate degrees in various healthcare disciplines. They have just built a brand new academic building which houses an extensive simulation center. In that center, the students are incorporating simulation as part of their education experience. So they no longer learn just didactic lectures sitting in classrooms, but they get to apply what they're learning hands-on around simulators in various courses. Advances in simulation technology are making Florida Hospital staff smarter, safer, and better healthcare providers. This is allowing Florida Hospital to further its mission of extending the healing ministry of Christ not only to our own patients, but to those around the world as well.